Hello, everyone, and welcome to the third episode of Thinkers Unlimited. Today, we have a double bonanza as I warmly welcome Helen Bevan and Göran Henriks to the discussion about change management and innovation in healthcare. Helen Bevan is the Chief Transformation Officer with the Horizons team, a group of internal change agents within the National Health Service. She is a thought leader and innovator within the NHS for nearly 30 years. In 2013, Helen initiated NHS Change Day with some trainee doctors, the biggest ever day of collective action to promote healthcare improvement, which started with a single tweet. This received the McKinsey HBR Leaders Everywhere Award from Gary Hamel's Management Innovation Exchange. For the last 6 years, Helen has led the School for Change Agents, a virtual school that brings together thousands of frontline change agents across the world and develops their skills and power to rock the boat but stay in it. 60,000 people have been through the school, and evaluations show it has made a significant difference both at an individual and organizational level. Göran Henriks is the Chief Executive of Learning and Innovation at Qulturum, Center for Development of Improvement Knowledge and Innovation in Healthcare from Sweden. Mr. Henriks has more than 30 years' experience of management in the Swedish healthcare system. He is a member of the region Jönköping County's Top Management and Strategic Group. He is a board member of the Swedish Institute for Quality. He is also appointed as the Senior Fellow at the Institute of Healthcare Improvement and a professor in quality management at University of Yerevan, Armenia. So Helen and Göran, thanks a ton for accepting my invite to this discourse.
It's an absolute pleasure. I think what you heard, from the introduction, that both Göran and I have been working in change in health and care for a very long time. And even though we're in different countries, I'm in England and Göran is in Sweden, we share so much perspective, and I think we can learn greatly from each other, across the borders of our country and other countries across the world.
So let's kind of start this up. And my first question is for Helen. As we've divided the timeline of humanity, I'll say from BC and maybe. Do you think healthcare shall be remembered in the long run as being in two eras, the pre-COVID-19 and post-COVID-19? How do you see healthcare permanently adapt post this pandemic?
Yeah. Yeah. So Göran and I, we talk about this topic a lot. And I mean, my sense is, what's happened as a response to COVID is that a lot of change has happened, much more quickly, and things that we dreamed of, for instance, working virtual consultations, changes in roles, change happening very quickly. We couldn't have dreamed that would have happened a year ago. And at the same time, many of the changes that we've seen as a result of the pandemic were changes that were happening anyway. So I think change was happening quickly before. As a result of the pandemic, it's happening, much more quickly. And beyond the pandemic, I think change will continue to happen very fast. So all of us, whoever we are, whether we're clinicians or managers or users of health and care, we need to be involved in change because it's going to carry on happening very quickly. So I think that yes, there's a before and after. But I think that actually a lot of the things that are in the after were actually there in the before. They're just happening more quickly. I mean, Göran, what do you think?
Well, I think that we are living in a unique period because I meet so many people that during this period had found their own learning point in their body. They see that they need both their brain and their mind and their hands and their hearts to get things together. And they are so thrilled of being in that momentum. It's tiring sometimes because it's so challenging, but it's also giving energy. And I think that Of course, it's very hard in this situation to talk about a thing that is necessary, but I think this pandemic has been necessary for all healthcare systems. We have found our own heart again.
So my next question is for Göran. If you have to predict the future in healthcare, what innovations in patient care delivery can we expect to see in the next decade?
I think that we are already in a new healthcare where people are monitoring themselves through their cell phones, iPhones, telephones, or through other equipments. And you can already see how diagnostic instruments are smaller and smaller and more handsome. And then I think that our mathematics gives us support to help people to understand problematic or complicated equations in new ways, because they are so strong, our computerized systems. And I think that will be a change driver for all healthcare, that people will be more and more autonomous and have their authority to take decisions around their own health in a much better way.
And
your thoughts, Helen?
Yeah, I absolutely agree with those things. I think the other thing that is happening is people are coming together in much more collective ways. So yes, we take the scientific wisdom of clinicians. So if we're patients, we listen to our doctors and other clinicians, but we also listen to our peers. And I think more and more we're seeing people coming together in online communities and supporting each other as patients and as users of particular services. People are connecting much more through social media. And I think that what it means for clinicians is, first of all, we need to be on social media, because that's where people are, where they're talking, and where we're learning. And secondly, I think we need to be working with these collectives, communities of patients or people that are brought together with a common health cause. So I think we need to work and connect in different ways as well.
And this together gives us a movement away from thinking about healthcare as a science of medicine to become a science of social and medicine science. And we will see how social entrepreneurship will push our system in a completely new direction. And I think that's very promising.
So true. So Helen, this one's for you. We all would love to hear from you your favorite change management case study, which gave you the most satisfaction and which could actually serve as an inspiration for the ones who are just beginning their change management journeys.
Yeah. So I've been a change leader in health and care for 30 years. And so I've worked on lots of different projects, but one I feel really proud and passionate about was a project that was across the whole of England. And it was about people living with dementia who were being given antipsychotic drugs in a way that wasn't appropriate. So in England, we can give antipsychotic drugs to people with living with dementia for a very short period of time. But what was happening was that many people who were living with dementia were being given antipsychotic drugs for a very long time, and they weren't being taken off of these drugs. So we had about 180,000 people who were being given these drugs, and probably only about 30,000 of people should actually be having these drugs. And so 150,000 people were being given antipsychotic drugs inappropriately, in a way that meant that, you know, people couldn't have the quality of life that they deserved. You know, they would, you know, very often these drugs would keep people quiet, but people living with dementia can have a quality of life, but not if they're sitting in a chair asleep because they're being given very powerful drugs inappropriately. So what was great about this change project was we worked with so many different people all over our country. So we worked with family physicians, we worked with hospital doctors, we worked with psychiatrists, we worked with people that ran care homes, we worked with pharmacists, we worked with people living with dementia and their families and their advocates. And we brought everybody together, like from across the representatives from across the whole country, and said, you know, we have to do something different. So we organised it like a social movement. Okay, so we had a goal that we co-produced, okay, with all the groups that had an interest, and the goal was about reviewing everybody who was being given these drugs, and where appropriate, you know, moving people away from these drugs, and everybody had to play their part. But I think what was wonderful about it was so many different groups of people and kinds of people coming together with a common goal, having a clear aim of what we wanted to achieve by a point in time, and actions for each group to take. And what was amazing was that in less than 3 years, we reduced the prescribing of these antipsychotic drugs to people living with dementia across the whole of England by 50%. And I just think, in terms of the difference it made to the lives of people, it was a really big difference. And yeah, it makes me feel proud to have been part of that.
That's a very inspirational story. Göran, anything that comes to your mind? I'm sure in your very long journey, something that, you know, is very close to your heart.
Well, I have to tell the story about Esther then. Esther is a woman that is 82 years of age, that lived in a small village outside our Jönköping area. And one day she called her daughter and she said that I'm feeling so bad. And the daughter tries to come during her coffee break home to her mother and find her in a bad shape. So she says, I have to call the district nurse. The district nurse comes and she says, I'm sorry, I'm not sure I can support you or help you, so we have to call from an ambulance. The ambulance comes and they go to a care center with a totally crowded waiting room. And now it's 11:30 and the doctor comes to Esther and says, have you reserved time in my schedule today? No, I have not. I'm just feeling so bad. Well, we will see if we have any spot open for you. So 1:15, she comes to the doctor and the doctor says we have to take laboratory tests. They take the test, the doctor sees Esther and finds that she cannot help her. She has to take a new ambulance to the bigger hospital and comes to a waiting room at that hospital that is totally overcrowded. Now it's 5:30 in the afternoon. After another hour, the nurse comes and says, we just have to change from day work to night workers. And then we will help you. So 7:30 in the evening, she get the doctor, a young doctor, not so experienced, coming up to Esther and says, we have to take laboratory tests. They take new laboratory tests, and at 9, the doctor says, we have to make you stay here at the hospital overnight. Now, Esther meets regularly 5 new people a month. This day she met 36 people. She didn't get any food during that day, and she was completely alone in this very frailty situation. When we started to understand that we had hundreds of patients every year that were forced into this situation, we decided to redesign our healthcare and started to talk about integrated care, started to talk about how can the nurse in the community have a direct line to the physicians so they don't have to send in the patients earlier than needed. And all that has given us a very, very strong understanding of the importance of the community.
The entire country has to thank one lady that, made that change possible. Wonderful story.
Yeah.
So this one's for both of you. Yes.
Yes.
Please go on. You wanted to say something.
No, I wanted to say that it gave us the understanding of radical customization, that we need to think through the patient's eyes what is good and what should happen when, and how do we define our challenges.
Yeah. So this one's for both of you. First Helen and then Göran. Life is always challenging us, sometimes beating us down, some days giving us more joy than we ever expected. So what keeps you going in your professional forays, come what may? And who has been your biggest inspiration? Helen.
Yeah, so I think Göran and I are both a little bit unusual because we've both been internal change agents in the system, for a very long time. And the one thing I'd say is that when you're a change agent, a change leader, you can't be a change agent on your own. However creative or innovative you are, however good your ideas are, when you're trying to make change happen in a big system, like my system, like the National Health Service, the system is always against you, in the sense that we have the status quo, we have ways of doing things. So you have to find other people that want the same things that you want, and you have to link up with others. You just can't make change happen on your own. So, and some of us are lucky, some of us have a boss or a line manager who understands change and will give us support, but not everybody's that lucky. So, for me, it's always about having people around me who will support me and I support them. And, by having many people that want change to happen, it's much easier to make change happen than when it's just you that wants change, that wants change to happen. And many people inspire me, but one of the people that inspired me the most was my mother. And my mother was a maid in a hospital. She was we'd say a domestic assistant, but she cleaned the floors and the toilets, and she worked for the National Health Service for 37 years in that job. And but her values were just fantastic, and she was so proud of being in the NHS and what the NHS meant, and she worked hard every single day, as a maid, as a domestic assistant, but she saw her job as being a bigger part of the National Health Service. And whenever I feel down or things are difficult or people are blocking the things I want to make happen. You know, I always think of my mum and how she felt about the NHS, and it makes me feel the same way. And it's an inspiration to me every single day.
Thanks, Helen. Göran, your thoughts?
Well, I think my mother was also very important, and I guess without her understanding of who I was and am, I wouldn't be where I am. So I have to confess that that is, of course, a very inspirational person. I think that I have got a lot of inspiration from other sectors. I met people when I worked as a psychologist that gave me a deeper understanding of listening. I met people when I was a sports teacher and a coach that to become a high performer takes some efforts, and the leadership to open up for those moments where people are high performers is a very special situation. And I think that that can be translated also to care, because we have high performers everywhere in healthcare, and you need to give them space to do that performance. And then, of course, all inspirational leaders all over the world in quality and patient safety that are such profound thinkers. That makes my job very, very energizing, and gives me a big respect for all the people, really.
And you know what I'd say, Göran, I again really agree with that. Like the situation that we find ourselves in, you know, at the moment in England, you know, it's very tough. You know, we have more people in our hospitals with COVID than has ever been the case before in the lockdown. And you know, or since the pandemic started. And just to see the everyday quiet courage of our clinical colleagues who go in every single day and do an absolute amazing job, it so inspires me, you know, to want to do what I do so much better.
I truly agree. I think the unanimous choice of all of us for the Times Person of the Year for 2020 has to be that frontline healthcare worker across the world. I think this was something which was so unprecedented, and the way they have put their safety at the last and, you know, taken care of, and not just in India or UK, I think across the world. I think we need to salute their efforts, and it continues. The struggle still continues, and I think if you look at Europe and US, the things are far worse than what they were right at the beginning of the pandemic. So yeah, really hard task for them. So, you know, with both of you with, you know, immense experience spanning decades, you know, what are the frequent challenges and roadblocks that you face whilst implementing, you know, change management strategies, and how do you eventually overcome them? Helen, and then Göran.
Yeah. So, you know, what I've learned over the years, when I think about the biggest mistakes that I've made in terms of improving health and care, I'd say I've made the same mistake over and over again, which is not involving or engaging the right people, you know, right at the beginning of change. Because I don't think you can do change to people. You have to do change you know, with people. And, you know, sometimes people, you know, we hear, oh, people don't want to change. And I just don't, in my experience, that's not true. It's not that people don't want to change. It's that people don't agree with the way that we're going about the change, you know, and I think working in co-production, where right from the beginning of a change project, you know, we involve our patients, we involve the people who are going to be affected by the change, and so they're leading the change as well, and making the investment in doing that, you know, right from the beginning, I think you know, is the most important thing that we need to do to avoid roadblocks or difficulties, later on. And of course, we work in very political systems, and very often there are political issues and people change. But it still comes back to that issue around people being investors in change. Sometimes people will say to me, I can't get the clinicians, or I can't get the doctors to buy into change. Okay, it's the wrong thing to be saying, because if you already decided what the change is and you're trying to get doctors to buy into it, it's very, very difficult. Okay, if we've actually involved and engaged those doctors right from the beginning, so it's their change as well, you just don't get the same issues. What do you think, Göran?
Oh, you talk so good, Helen. I think this point where you find tension for change is very crucial. And I believe that all people between their stomach and their heart have this point of, I need to change. But you have to find that place in people's body so they can talk about it and put words on the gaps they see. And then they need a team or a support system around them that helps them to find a good way to minimize that gap or that tension. And every journey you get where people go to and reach the aim they have set up, and they understand why they reached that aim or missed that aim, then you have won a heart for change, because people needs to do it and feel it, and then it works. Otherwise, I see two more challenges that I immediately was thinking about. One is that for me, it is the system results that counts, and to get the balance or deal with the dilemma that we have a lot of people that think it is my doing that counts, but that is not enough, because for our customer it is a system they meet, so it's the wholeness and the system result that counts. I think that we are still dealing with that challenge a lot, and connected to that is the tension between vertical integration and horizontal integration. The patient asks for horizontal integrations, and we quite often develop vertical integrations. And that is a challenge that I think you have to live with. It's not you can't solve that problem, but you need to find good ways to put words on that tension.
Thank you. This one is for both of you. What is in store for you in your tomorrow if you had control over it? What can we expect you to delve into? Is there something that you wish to do which you haven't done yet, Helen?
Let's let Göran go first. Yeah, go on.
Yeah.
If there is something that I wish to do that I haven't done yet?
Yes, yes.
That's a tough question, because I think I live in the best time ever, even though we have the pandemic now. And I like to contribute to that time, and that is my part of the world, that the best I can do every day makes a good world for me and hopefully for others. So I'm not sure I can answer that. And of course, I can do something else completely different, but I'm not sure I find something better than being where I am. So if that is an answer you're okay with.
I think that's a great answer, Göran, and I think we're all privileged to be where we are now. I think for me, what I kind of look forward to is that all my life I have been a challenger of the status quo and an activist and tried to be a movement leader. So as I think about my own old age, I think I'm going to be an old person activist. So I've told my family this. I've said, don't expect me to be an old person who sits around and reads books and watches television. I'm going to be an old person revolutionary and work for the rights of old people. So watch this space.
So thanks, Helen and Göran, for a very engrossing discussion, and I'm sure the viewers would enjoy and gain a lot from it, and look forward to all of you to kind of like, share, comment, and subscribe to this channel. And for the viewers, we would like to know from them who are the future guests they would like to see on this channel, and especially discussing about what. Please share in the comments. And thanks once again, Helen and Göran, for taking out time for this discussion.
Thank you very much.
Yeah, it's been great.
Thank you.
Great.
And until we meet again, stay safe.
Thank you, sir.
Bye.
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 Have a lovely day. Bye-bye. Thank you.